Nosebleed can be terrifying. They lie down, try to sleep it off, and eventually they get up vomiting blood if the bleeding is profuse because they're swallowing all the blood. Just to keep it away from coming out from their nose, people can have blood entering their throat and they're vomiting blood. So it can be actually terrifying. And they're unaware that they're doing it. By injuring the lining inside the nose, these areas can start bleeding because this is a very vascular area. All of these need to be addressed medically first. Hi friends, I'm Dr. Rohit Udaya Prasad, lead consultant for ENT, cochlear implants, and skull surgery at Vikram Aura Hospitals, Bangalore. Today I'll be talking to you about some issue which all age group people face, which is nosebleed. Nosebleed can be terrifying for people who see it or people who experience it because it's right in your face. You can have profuse nasal bleeding, people can have blood trickling out of their nose, people can have blood entering their throat and they're vomiting blood. So it can be actually terrifying. A lot of the times, the patients who have these kind of issues either lie down, try to sleep it off, and eventually they get up vomiting blood if the bleeding is profuse because they're swallowing all the blood. Just to keep it away from coming out from their nose, they lie down. That's the first mistake people do. Most common causes of nosebleed in all age groups is nose picking, or a simple cause or one of the most common causes. So look at most common causes always first. Nose picking is something which people do every day. Kids put their fingers in the nose, adults do it, elderly do it. So it is not something which is uncommon or something which people deny, but most of them do it and they are unaware that they're doing it. By injuring the lining inside the nose, these areas can start bleeding because this is a very vascular area. There are multiple blood vessels which reach out and the point is called as Little's area. Some people experience nosebleed in children, especially if they have stuffed up something in their nose, inside their nose, like a foreign body, and it's been lodged there for many days or many months, and then they don't realize that it is there. So they have one-sided nasal bleed. That's itself a clue for us to look out for something which has been lodged inside the nose. Some kids come with nosebleed due to inherent blood-related issues which have to be treated medically first. There are also certain lesions, like certain tumors, which are probably benign, but there are vascular tumors which can also cause nasal bleed. Always look at most common causes first. In the elderly, most of them do have nasal bleeds, either which I told you can be because of nose picking, can again be because of trauma, can because they fell, can also be because of issues where there has had a raised blood pressures or an accelerated hypertension. Sometimes by nasal bleed itself can lead the BP to shoot up. Some patients can have a very high blood pressure, undiagnosed, and then can end up in the ER or the trauma center with a nasal bleed. All of these need to be addressed medically first, stabilized, and then taken care so that you're doing a holistic approach for the patient. Nosebleed can be also due to simple infections left untreated, which can be your rhinitis, rhinosinusitis, which can, the patient is blowing his nose hard or trying to clear up the mucus and the nose starts bleeding. First and primary, most important thing is most of them can be stopped by sitting upright, bending forwards, pinching both the nostrils, and then breathing from your mouth with the pressure on for 3 to 5 minutes. It stops, you're done, but still visit the doctor to get your nose checked. If it doesn't stop, get into the car or vehicle and then visit the hospital so that it can be taken care of. They might require a simple nasal packing, they might require an electro cautery, they might require something more advanced which can be diagnosed once you visit. So don't ignore the nosebleed. It can be a very simple cause, it can be a very dramatic cause. Eventually that has to be cleared out. Thank you.